Well, first off, I'm Dr. Joanie Winstead. I'm a chiropractor. I have done a lot more than the average chiropractor. We're required to do like 12 hours of education, continuing education. I have done lots of other things. I have gone back to school to become a chiropractic neurologist. I have over 300 hours with the Carrick Institute in Atlanta, Georgia. I have also taken Functional Medicine University. I have taken about 100 hours through APEX seminars, which is Mastering the Thyroid. I've taken classes on functional blood chemistry, functional endocrinology, neurotransmitters in the brain, numerous things outside of just the chiropractic mode. And that is why I'm able to help a lot of chronic conditions. And so today we're actually here to talk about chronic knee pain. We're just going to talk a couple things and how I address the knee pain. Well, first off, this is your knee, structure of your knee, okay? It is made up of femur, which is our bone here, the big bone in our leg. This is our tibia, or what people think is the shin bone. It's the one on the inside of the leg. And then here's our fibula, which is on the outside of the leg. And then our patella, or kneecap. Okay. This joint, it's kind of a hinge joint. It should move freely. The meniscus is inside it. You have different anterior cruciate ligaments, lateral ligaments, posterior ligaments, all those things that kind of hold the knee in place. So we'll talk a little bit about some of the things that make sense to people and why we can have knee pain. Well, one being trauma to the knee. You can injure your knee, and of course you're going to have some knee issues. A lot of people have played ball, and me for instance, and I'm going to give you some examples along the way. I played softball, basketball, any kind of sport I could play, I played. And it was probably 5 years ago. I was, how old am I? 37. So about 32 when I first, that wasn't when I started working, but I had been working as a chiropractor. I have two offices. I have one in Carthage that I'm at on Tuesdays and Thursdays, and I'm here on Mondays and Wednesdays right now. I'm actually looking for someone to help me there, so I'm here more. But, and in that office, I see probably 50 patients a day. So I'm on my feet all the time, and it got to the point where my knees hurt me so bad every night I couldn't stand it. And when the weather changed, I had such pressure in my knee, I wanted to stick a needle in it to relieve the pressure. And I thought, I'm 32. I shouldn't hurt like this. And so after going back to school, learning the stuff I've learned, I did a lot of things on myself, found out a lot of things going on with me. We won't get into all of that, but long story short, decreased inflammation in my body, changing diet, doing a couple of things, and no knee pain. Okay, so there's a lot of things we can do, and there's a lot of times that you have knee pain and it is not your knee that's the problem, and that's why nobody can figure out what's going on with you, because your knees are not the problem. My knees are not the problem. It was a lot of other things going on in my body. I have been hard on my knees, but the knee joint itself was not a problem. So, hey, Miss Joan. But, so there are times when it is the knee, and we need to do some structural work, things like that. There's times where people ask me all the time, bone on bone. Can we do anything about bone on bone? Yes, there's a lot of things we can do about bone on bone. I cannot put anything in there to make it cushion, but we can do supplements to help decrease the inflammation there. I do laser, do numerous things, and we'll talk a little bit more about the things that we do to help it. So, but one of the main things is trauma, okay? The other thing that people don't realize is you can, well, and me, for instance, I have horrible ankles. I've turned my ankles. That's part of my knee pain. My ankles. If you turn your ankle, if you have bad ankles, any slight eversion or inversion changes the pressure on your knees, changes your hips. So you can have structural things going on in your ankles that cause you to have knee pain. You can have things in your low back that cause you to have knee pain. You can have degeneration of the spine because this L3 goes down into the knee here. Numerous things can cause the pain without it actually being your knee. So there's a lot of structural things that can happen. Now we're going to talk some more things that people don't understand and don't realize that could be a problem. And that one of the things is the neurology aspect. And if you look here, which we all of us mostly know, that the brain controls everything in our body. Okay? It is like our master switchboard. It controls everything. So if our brain is not functioning properly, we're not inhibiting pain as we should, other things happen. I'm going to kind of draw a schematic here about how the brain works, and hopefully everybody can see it. But you have a left brain, right brain. You have what's called a cerebellum. You have left and right. You have a mesencephalon, which is part of our brain stem. And you have a pons and a medulla, which is also part of our brain stem. And how all of this talks to each other, you have the left brain talks down here to the pons and the medulla. The right brain talks to the pons and the medulla. That talks to your mesencephalon, which talks to the cerebellum. And then the left cerebellum talks to the right brain, right cerebellum talks to left brain. This is what's called a brain loop. When this is functioning like it should, our brain is functioning how it should properly at its utmost. What happens in life, stress. We're all stressed. Whether it's chemical, emotional, physical, stresses in life will decrease function. When that happens, our mesencephalon doesn't get the proper signals from both areas, and so it starts to overfire. When this mesencephalon overfires, several things happen. I'll give you a couple of examples. One of the things is you can have chronic fatigue. You can have, you can start having constipation, diarrhea, either or. You can have area where you can't sleep at night. You don't rest good. You can have the chronic pain pathway because it's not inhibited like it should. Numerous things happen. In the cerebellum, what the cerebellum does is our postural muscles, holds us upright. Okay? If our cerebellum's not talking and getting the input it needs to, it's not getting activated like it should. So then we start kind of going over. You see a lot of elderly people, this is happening to them. They're going to get that forward posture. A lot of that is a decrease in brain function. That happens over time. When those things happen, we start having subluxations in our spine because our posture changes. Things get locked up, start putting pressure on things. So you can have some of that structural stuff that starts going into play because your cerebellum is not functioning right. So, and if that's the case, honestly, the only way to take care of that problem is to increase function in the brain, to increase posture, to make things work correctly, and then the pain will decrease. The other thing with cerebellum is if anybody experiences dizziness, change in, in light, if you're sensitive to light when you never were before, numerous things happen that gives us signs that this is some of the things that's going on with you. The other thing, metabolic aspect. And that form that I had you fill out, we're going to talk about in a moment. The other thing I need you to know is 20% of the people who come in the door actually only have a knee pain. Other 80% have metabolic, neurology, some other aspect. When we started talking about bone on bone. He's a farmer. He has cattle. I don't know if he has chickens. He's a farmer. And he came in to me, he's 78 years old, and he came in with knee pain. I ran an ad in Carthage, and he was telling me the VA's telling him he's got to have knee replacement. He didn't want that. He's a very active man, up and down off the tractor, fishes, hunts, does all of that. And he asked me if I could help him, and we found out a couple of things that was going on with him. After about 6 treatments, he was about 70% better. Okay, he's not 100%, but he is happy with where he's at. I can't make you 20 years younger or 40 years younger. But, there's a lot that we can do to relieve your symptoms enough to give you your life back. He's extremely happy because he can get out in his yard, get on his tractor. He can do what he wants to do without having pain and without hurting at night because he's doing what he wants to do. So essentially, he got his life back. Now we're back to the metabolic aspect, and that's the forms I had you fill out, okay? And so you can look at them as we go over this. But that category number 1, if you have any 1s, 2s, or 3s marked on there, that lets me know that we have some colon problems, okay? And y'all can just take notes if you need to. And I'm going to do just like this. We're going to do, it's called the web of physiological dysfunction. this is showing you guys, and it will show me if there's more going on with you than just your knee. So what I have people do is put the knee in the middle, because that's what you're here talking about. And if you have category 1, if you have 1s, 2s, or 3s marked, you can write colon, and we'll discuss a little bit of why that's important momentarily. Category 2 is your intestine. If you have 1s, 2s, or 3s marked, write down intestine. Sorry. Category number 3 is chemical toxins. And we are all bombarded with chemical toxins every day. Sometimes it lingers and bothers people differently. But like I talked about on stress and how it changes our brain, the chemical toxicity is one of the things that affects our brain when it comes to stresses. Category 4 and 5 is stomach. So if you have any 1s, 2s, or 3s, you can mark stomach. Category number 6 is small intestine and pancreas. Stomach. 4 and 5 are both stomach. Small intestine or pancreas. And we're going to talk a little bit about some of all this later. Category number 7 is biliary or gallbladder. Well, do you still have symptoms? Yeah. Okay. Water makes them heartburn. Yeah. Well, we'll talk about that. Maybe not necessarily right now, but there's a lot of things. Because that's the thing, most people who have their gallbladder removed still have their gallbladder symptoms. So that tells me in itself that it was not the gallbladder that was the actual problem. All right? And that happens more than not. Category number 8 is your hepatic detoxification support, or your liver. We just put down liver, that's simpler. That's 8. 7 was gallbladder. 6 was small intestine. And we'll talk a little bit about the liver here. The liver is our detoxing organ, okay? It's important for bowel production and excretion. It metabolizes our fats, our proteins, and our carbohydrates. And so there's a lot of times that I look at blood work. I do have blood work ran on people sometimes. And a normal, healthy individual that you see them, they think they're healthy. You look at them, you think they're healthy. But they come back as malnourished. Okay? A lot of times it's because, their liver's not functioning properly, their stomach's not functioning properly, their intestines isn't functioning properly, so they're not absorbing the nutrients that they are eating. So that's a huge problem that most people don't even realize they have. But I get tons of people with malabsorption issues, malnourishment issues, and it's not that they don't eat. It's that their body is not utilizing what they eat, which causes inflammation in our system and lots of other things. Liver is also important for the storage of glycogen, vitamins, and minerals. And it detoxes your blood and purifies things. Categories 9 and 10, that's blood sugar. And the majority of us, and when I say us, that includes me, have problems with this. And it doesn't mean you're diabetic. Well, I don't have a problem with it anymore. I've changed the way I eat and changed things. And when we say a problem with it, it's dysglycemia a lot of times. We don't eat what we should eat. Our blood sugar drops. Then we want to eat sweets. We want to eat things to bring it up. Then it goes way too high. Then it drops again. So it's just up and down. When that happens, it releases cortisol in our body. Cortisol is inflammatory. Okay, so it's one of those things. And I had a patient earlier today, actually. She came in Monday, and she was telling me that her wrists were hurting and her knee was hurting, just out of the blue. So we start kind of backtracking on what did you do, what's happened. Well, there's a restaurant she went to eat at. She asked them make sure they didn't put MSG, gluten, that sort of thing in it. And they did. Okay, so it caused inflammation in those areas of her body. She's autoimmune, which means your body can attack you in any area it wants to at any time that it wants to. And so she had a flare-up, and it hit her knee this time. So, and with cortisol, when you have a flare-up, when you have the inflammation like that, it's like getting a blowtorch and just, I mean, if I brought a blowtorch in here and just put on this poster right there, it would burn up. Okay, so it can attack any area. It can do what it wants to. So when your cortisol, or when your blood sugar is up and down, you're releasing too much cortisol. It's basically like you're putting a blowtorch in your body, whatever it wants to attack. If it's your thyroid, a lot of women have thyroid problems. A lot of men have thyroid problems, but women more so than men. People who, and we'll talk about the thyroid in a minute because it's on down there. If you can't, cold hands and feet all the time, sluggish, can't get going, those type of things, that's a lot of symptoms of thyroid. Categories 11 to 12 are your adrenals. Our adrenal glands are our stress organs. Okay, they produce cortisol as well. These two create a vicious cycle that causes inflammation in the body that can be a source of knee pain. Okay. She can't hear me?
No, my friend out who brought me really needs to be in here listening.
Oh, okay. Okay. All right. Number 13 is electrolytes and pH. All right. Why is pH important? We're supposed to have a certain amount of acidity. We're not completely alkaline, but if we're too acidic, basically, and most of us are, it leaches minerals from your bone, and that leads to osteopenia, osteoporosis, things like that. You're also at a greater risk for heavy metal toxicity if your pH is acidic. I was acidic. All right. All this stuff, the stuff that I'm talking about and that we will go over later about things that I may have, if you become a patient of mine, things that we will do, I've done them all on me, okay? There's not one thing that you will have to do that I haven't done, haven't tested on myself. And I'll give you a little history on me a little bit later. But if you're too acidic, and the majority of us are, if you drink coffee, if you drink soft drinks, if you drink things like that, a lot of times we are acidic. And then your body can't break down, can't do what it needs to. Categories number 14 and 15 are thyroid. Thyroid is important because it's our shield. It sits over our neck. It's like an H shape. It is our shield. It regulates our body temperature. It helps in our energy. All of those things. And I'm sure if you marked them, you'll see, and I'll see later. But sluggish, hair falling out, dry skin, can't get going, numerous things like that are hypothyroid. A lot of times, that along with a lot of these other things, major inflammation in the body. Category 16 to 17 is pituitary support. All right. I'm about to run out of room. And our pituitary gland is in our brain. And I wasn't going to do this, but I'm going to do just a little bit. We're going to talk a little bit about how the brain function can cause thyroid problems as well. So to begin with, we have a hypothalamus in our brain. All right. It talks to our pituitary gland. This is the thyroid pathway right here, which is in the brain. This releases thyroid-releasing hormone to the pituitary gland, which releases thyroid-stimulating hormone to our thyroid gland. The thyroid gland releases T4, T3. T4 and T3, our T4 is is our inactive form. T3 is the active form. Okay. 93% of what released is inactive, 7% of what released is active. We have to change this from our inactive form to our active form. The way we do that, 60% of it is changed in the liver, 20% in the gut, and 20% in other cells of our body. Okay, so that's why a lot of people have thyroid symptoms, and the doctors will tell them your thyroid's fine. Okay, this was me. I had thyroid symptoms. I was sluggish. I had knee pain. I had a lot of things. I had gut issues. I had a little sluggish liver, so I wasn't doing what I needed to do for this. So I was inflamed. My body had a lot of inflammation. That's why I had the knee pain. So there's a lot of this that causes knee pain. But the pituitary is in our brain. It's kind of the start of the thyroid. So if you have some pituitary problems there, then that lets me know we need to look at a couple of other things. So, and all the other markers are hormones. And if you're female and you started filling out the male information, that tells me you have a bad brain. Okay? And if you're male and you filled out female, that tells me you have a bad brain. Okay? Other signs of a bad brain are you walk in a room and you forget what you went in there for. Okay? You park your car outside of the mall and you walk out and you have no idea where your car is. You know, you hear the panic button all the time, and it's really not because somebody's panicked, it's they're looking for their car. You know, you just little things that, and it's honestly, a lot of people think it's old age, we're getting older, that's okay. No, I mean, to an extent, there are things that because you are getting older should happen, but just because you're over 60 doesn't mean you're falling apart, and you should just say, you shouldn't hurt because you're getting older. You shouldn't have dementia because you're getting older. None of that is just because I'm getting older, okay? It's because something is going on in your body, causing inflammation, decreasing your brain function. And there's a lot of reasons for that. And things that we do in my office to address knee pain, well, we will, if we need to, we will address all of these things. If you are one of the 20% that only have a knee problem, then we address knee pain we do a cold laser. What the cold laser does, it's not painful. It's basically a cold red laser we put on the knee. It decreases an inflammatory response if you have it in the knee itself, promotes healing. There's some studies out there. I'm not going to say that it helps to grow cartilage back or anything like that. There's some studies saying that it may. I don't say that. I just know it helps decrease pain in the knee. We have what's called a decompression unit. A lot of times people have, like I said, if the joint's not sitting just properly, we have you on decompression, and what that does is it tractions this joint, and it puts a pumping action in it. And we'll have you drinking water and doing different things to help lubricate the joint as we traction it, get some of the pain down. Lifestyle change is one of the things we have to do if you're having major inflammatory reaction systemically. Those things are diet related, okay? And I don't like to say it's a diet because it's a lifestyle change. With me, I had, like I told you, I had lots of things. I had a lot of symptoms. I was in chiropractic school and I had a headache every day. And I remember asking one of my professors, how am I supposed to go out and tell people I can help them with a headache when I'm here at the clinic 4 days a week getting adjusted and I have a headache every day? You know, and he kind of just looked at me. Well, I was too far not to do it. I wasn't going to quit and say I don't know how to help a headache, so I'm not going to do it. And so I got out of practice, and I got out and I practiced. I opened my practice in Carthage in 2004. Wow, it's been almost 10 years. I opened in 2004, and part of why I started learning all of this, and I'll tell y'all this, not to get too far off, was my grandmother. She was, at the time, that's probably been in 2010 is when I really started learning all this additional stuff. So that was, 4 years ago? So she'll be 78 in March. So she was 75, 74, something like that. And she kept falling all the time. Now, my grandmother can run circles around me. All right, you know, from the old school, they get up at dawn, they start working, they'd go to bed at, you know, when the sun went down. But she was 78, always worked. My high school year in college, she had a ruptured disc, so they did back surgery on her then, and then the next year they had to. But outside of back surgery, my grandmother was a picture of health. So she started falling and had neuropathy. I don't know if anybody knows what neuropathy is. Numbness, tingling in the feet, can't feel your feet. And the number one cause of death in people over 65 is they fall. Okay? Well, I'm not ready for my grandmother to be gone. I told her she has to live to be 100. So she's got to be around another 30 years. So, and it kept scaring me because her last fall, she fell face forward, hit her head, those type things. And I thought something's got to be done. And she was coming down here to the best neurologist, and I'm not. The lady did what she knew to do. She was on Neurontin 3 times a day, getting nothing, getting no better. You know, things were just getting worse. So I did all this stuff on my grandmother, tweaked her diet a little bit, changed a couple of things, did some, you know, decompression, supplemented her properly. And I'll tell you, she had a gut problem. She had a blood sugar problem. She had a thyroid issue, which it was kind of all related to a diet, which she had a great diet, but there was a particular food that was causing her to have some problems. And so we got that out of her diet, and probably 6 months later, she's no longer on Neurontin, okay? With the help of her internal medicine doctor, she was able to get off the medication, and she has not fallen since, okay? And that was, I think I started that in 2010. So for the last 3 years, and she bought a zero-turn lawnmower last year, okay? So she just, you know, she goes. And that's what I told her. I said, and she's honestly a lot of the reason why I wanted to learn how to do this, because she's my buddy, you know. I talk to her every night at 9 o'clock, and I'm not ready to get rid of her, so she's going to be around for another 30 years. And so that was part of why I went back to learn all of this. And she's had knee surgery in the past, and she's had some knee issues, and all that resolved and went away as well, okay? So there's a lot to it. It's not just strictly knee. You know, and that's why, and I'm not, the medical community, I'm not anti-medicine, not in the least, but I don't think they're capable of dealing with chronic pain. They just don't have what they need for chronic. If you have a heart attack, you know, by all means go. Don't come to me with a heart attack. Don't come to me with a broken bone. Go where they can take care of you. But I think they have failed us as a society when it comes to chronic conditions. They have a tendency to try to look at the actual the area of complaint versus your whole body to see why that's hurting, what's causing that to hurt. So, but that's my grandmother, and that's why I did this. Me, thyroid problems, and I'll tell you, I had, like I said, I ended up having a parasite that I didn't even have a clue that I had. It's causing gut problems with me, causing my stomach problems, so I wasn't converting my T4 into T3 into the usable form. I had, like I said, blood sugar. Wasn't diabetic, but my blood sugar was up and down. I wasn't controlling it like I needed to. I had, like I said, a decrease in liver, and I'll tell you mine, I had a gluten problem. I cannot eat gluten, okay? And when I stopped eating it, I'm telling you, I dropped 60 pounds like that. Just decreased the inflammation in my body. And I had a pretty decent diet. That was the one thing, because I knew my diet, I was still overweight, but I don't eat fast foods. I don't drink soft drinks. I don't do things that normal people did, and I was still overweight. And found out gluten was one of the problems, stopped eating it. I don't have any problems. So sometimes it's foods. I'm not saying that's your problem, but sometimes it's food. I know Miss Joan had some food issues. Miss Joan is a patient of mine, and yes. So Miss Joan has been through all of this and done a lot. So, but with this, it's a 70-30 rule, okay? 30% of it is me figuring out what's going on in your body and telling you what to do, and 70% is you got to do it, okay? It's like, you know, you can lead a horse to water, but you can't make him drink. I can tell you things to do. If you choose not to do it, you're not going to get any better, And we'll kind of just go to this. The patients that I like to say, I don't accept all patients. I want people who are committed to getting healthy, to changing their lives, getting their lives back so they can function and do things they want to do. And the big one that most people always say, insurance. Does insurance pay for it? Some yes, some no. I don't know. A lot of times it does not pay for chronic stuff. Depends on what's going on with you. Depends on what we find. I will tell you this, care is affordable. I do my best to make it as affordable as we can and still give you the quality care that you need. Medicare? No. Okay. I tell you, Medicare pays for acute care, and it pays for chiropractic to do stuff with the spine. If it's chronic condition, it won't pay. Okay. And that's why I said, but we make it affordable. You know, and like I tell everybody, if you're not able to do what you need to do and have the life that you want, if someone can help you get your life back to, I mean, that's a priceless thing, you know. So with that being said, I'm going to go ahead and tell you what we're going to do for today. And because you're here in my class, we do a special, okay? What you do is you'll get an exam, you'll get a report of findings where I will bring you back in here, we will sit down, we will talk about those sheets, you will have other paperwork to fill out to help me determine which route we need to go with your body. We'll do, like I said, a report, because I will go over all of that with you. I will give you my best recommendation of care, and we'll sit down and talk about what I think needs to be done, and you'll get 2 free visits, okay? That's how I do everybody who comes to class. That is with a $79 startup fee, and you pay it today to reserve your seat, okay? And Cindy has cards and different things that, because don't you have the cards out? Okay. The way we do it, instead of making it hard, she'll have 2 cards with a time for a new patient slot. You decide what day and time you can do it. You take one of the cards, you write your name on the other card, you leave it with us, okay? And then you take care of the $79, and that reserves your fee, and we will get you seen. A couple of things, though, if that's what you want to do. That we will send you home with some paperwork, and it's a lot of paperwork, okay? Because there's a lot that I have to know about, so I'll know what direction we need to take. Have that paperwork filled out before you get here, okay? If you don't have it filled out, we're going to have to reschedule you, because I don't like to wait at a doctor's office, and I don't like people to have to wait, okay? So if at all possible, and there's sometimes when things mess up and you have to wait 15, 20 minutes, but that's the most that you'll wait at my office. I hate to wait. So, but have your paperwork filled out so we don't mess up and have someone waiting. And be on time. Bring a pair of shorts, okay? Because when you come, we'll do a knee exam. We will be working, I'll be checking, there's large diameter afferent fibers. That's one thing I didn't address in here. But our large diameter afferent fibers decrease pain. They inhibit pain. That's one of the very first things to go when you have blood sugar issues, when you have inflammation in your body. Because I would bet at least half of you in here, if I were to test them today, you couldn't feel it. You wouldn't know it. It's a test that lets me, it's for touch. And a lot of times people can't feel their feet, and you don't know you can't feel your feet until I start doing an exam on you, okay? But I test everything, so we'll need shorts so I can get to your legs and your feet. Be prepared to be here at for about 45 minutes. The exam may not take that long, but I allot at least that 45 minutes, so we can take that long if we need to. And I guess, that's really about it. If you're interested, Cindy will take care of you. But like I said, there's a lot to it. Sometimes it is just the knee, and if it is just the knee, then you're an easy case for me. If it's more than just the knee, you're not necessarily an easy case, but it's a case we can figure out. And you can get your life back and enjoy yourself. So, any questions from anybody, anything? I do not draw blood here. What I do, if you have any recent blood work, usually I have you bring it in. That's one thing I did not put down. If you have recent blood work, bring it in. I will look at it. If we need to do more blood work, I send people to LabCorp on 25. Huh?
A year, say, a year late April, is that recent enough, or?
It gives me a starting point. It depends on what the blood work shows me. But yes, sometimes with it being that old, it depends on what's in it, whether or not we have to run some more. But when we, when I see it and go over it, we'll figure it out and go from there. So, but yes, sir.
You believe in cortisone and or rooster shots in the knee?
Well, I'll tell you this. I don't like them because it's a Band-Aid. Okay? Rooster cone not as much as a cortisol. But what it does is it's going to decrease the inflammation at that moment, and a lot of times it doesn't last long. What it does is it allows you to be pain-free for a little while, and you go out and you do stuff, and you end up worse off than you were when you started because it basically just covers it up until it wears off, and that's what happens. And that's the thing. That's why when you find the source of the problem and you get to the source of the problem versus giving the shots to cover it up, that's when you can be knee pain-free.
So what do they say you're bone on bone?
Well, and okay, there. Sometimes you are bone on bone. But here's my thing. Here's my take on that. It didn't just happen. A lot of people. There's a lot of people that are walking around bone on bone that don't have pain. Okay. A lot of that is the inflammatory reaction that's happening in your body for whatever reason. Okay, and that's what I'm saying. We get to the cause of the inflammation that's causing it. Like that gentleman, his was bone on the inside of his knee. They were ready to do a knee replacement. He didn't have to because we did some stuff to decrease his inflammation, and his knee pain went away. Or his didn't 100% go away, but he was satisfied. Like with my grandmother, she's not her neuropathy. She has 3 nights a month maybe that she has pain in her feet. But she's okay with that versus every night, because she's the type that used to walk out on the concrete because it's cold, put your feet on it because your feet hurt so bad, and which is the wrong thing to do if you have neuropathy, because then you're going to damage the nerves even more because you have no idea, you can't feel it. So, but it just, when you get to the source, then you kind of know. But the bone on bone, and that's like people with arthritis, okay? At a certain age, every one of us have arthritis. But some of us don't hurt, and others do. It's because of the inflammatory reaction that's going on in your body from some other reason. What's happening in your body, and why is it causing your arthritis to hurt you when this person, maybe 15 years older than you, has no arthritic pain?
I take a toxin, I'm good for about 5 or 6 hours.
Yeah. Yeah. And that's the same thing as it's not the same, but it's along the same lines as getting the shot. You're covering it up. Covering the pain at that point, and a lot of times you go out and you do stuff and you end up hurting the knee more than you should because the pain's not there right then. And because pain is our friend, it allows us not to injure our body anymore. And when we take the naproxen or the Advil and things like that, we don't have the pain. We go out and we do stuff, and we're just continuing to injure that area or cause a problem there. So, but a lot of the problem is an inflammatory reaction. And it depends. It all depends on what's going on in your body.
Okay, can you tell if it's like an injury? Because I just had a torn meniscus on my right knee. I had that repaired, but I still have a problem. And now my left knee, keeps saying inflammation, but it's been since December and it still hurts.
Well, and a lot of times in that respect, when you have surgery on one leg, your other one starts taking more of the brunt of the weight and pressure and all, and it does cause a lot of issues, cause lots of inflammatory reactions. But there's a reason for the inflammation somewhere. There's something else. Well, thank you. Glad other people think I make sense. So, do what? Yeah. So, but if you're interested in trying to get to the bottom of it, we'll do our best and get you.
That's all they keep saying, inflammation.
Yep.
And I get the shot, and I do better for a little while, and
then it comes back.
And I'm tired of it, but I don't want surgery.
Right.
I'm terrified of having my knees done.
Yeah. Well, and like in that one instance, he's just one of the few that I've helped. I have a lady here in Jackson that's she's probably 68 or so, and she runs. And she came to me. Yeah. And see, she came to me, I don't even know when, back when I was over there. And she, because she couldn't run. It hurt, you know. Yeah. And she wanted her life back, so we started working with her. And she was going to give me a testimonial, and she hadn't got it emailed to me yet. But anyway, she told me she'd come and speak, but she can't come on Wednesdays. She can come on Mondays, but she can't come on Wednesdays. But she's back to running, you know, 68 years old. So, yep. But you can. But maybe you could, you know. Not that you have to run, but the fact that you might feel well enough to run. That's what we're shooting for. Getting you to where you feel like being a human being again. So, but well, Cindy will get you taken care of, and I'm glad you guys came out on this nice warm day. Somebody forgot to tell them to turn that heat on outside. So, and I'm glad to see everybody survive the snow. But Cindy will get you all taken care of if you're interested, and we will see you. Yes, $79 covers an exam that I will do, a report of findings, which is when you will come back and we'll sit down and we'll go over all your paperwork, and I will tell you that this is what I think is going on, and this is what I think we need to do. That's the report. And then the day of the report, you will we'll do a treatment, and then when you come back the next time, you will get another treatment. So we would do 2 free treatments, an exam, and a report for the $79. Okay. So, and after that report, that's when, you know, like I said, we'll sit down and talk, and then we'll figure out if you become a patient.